Today's topic is on understanding and healing children who act out sexually. This is based on my book with the same title. My name is Dr. Daria Shewchuk, and I am a registered psychologist. I've provided child therapy for many years and have taught at universities, trained therapists, and I'm quite passionate about my work. So, I will address 3 questions. Why do some children act out sexually? Can these children heal, and how? And lastly, some of the research in this area. Children sexually act out for many reasons, but the most common one is that the child has been sexually abused themselves or exposed to inappropriate sexual stimuli. Children can heal. The prognosis is best if the treatment is prompt, provided in a developmentally appropriate way, and in a trauma-informed way. I had another question as to motivation for writing this book. I've had so many questions over the years from students, from others. This book pulls together topics and themes related to trauma and why children sexually act out that isn't available in one book. Who is this information useful for? This talk is meant for parents, caregivers, daycare staff, teachers, lawyers, judges, therapists, but it's also for adults who had experienced childhood abuse. I've had a number of adults who have read the book be surprised at how healing they found it. To understand this information, to put into context why they behaved the way they did way back when they were a young child. There are many other topics that are covered in my book. For example, there's a big difference between what is psychologically right for a child and what may be the needs of the legal system or child welfare system. It's important to understand the neurobiology of these things, memory functioning, things like dissociation, amnesia. Important to understand that children communicate primarily through play and primarily through their implicit learning rather than explicit learning. They will play things out that they cannot put into words, and that they may not be able to put into words ever. Or, at times when they're an adult, they can finally put some things into words. So, knowing how to understand a child's nonverbal behavior, what a child is communicating through play, is critical. I would just want to talk generally about providing therapy with children. Adults often think of talk therapy, but with children, we use primarily play therapy, especially with young children. Adults process information by talking it out, but children usually process information by playing it out. Adults learn through explicit learning, the kind of learning you have in school where you actively taught something, and implicit learning, the kind of learning that you kind of pick up from your environment. Most social learning is implicit learning. We don't really think about what we're learning, we just kind of pick it up. We pick up things based on body language, and we learn that body language and pick up relationship patterns that way. And usually this kind of learning is not very conscious. Often clients come in and say, why do I keep acting out in the same kinds of ways or behaving the same, repeating the same kind of patterns? Well, this usually is from implicit learning. So adults learn something. They can talk about it, process it verbally, but children play it out. When a mother is pregnant, what does a child do? Well, usually they put a pillow under their clothes and pretend they're pregnant. If a mother has a child, a baby, the child will often pretend they have a baby. If a child's in a car accident, they'll often play out scenes of car accidents. So, why do children sexually abuse other children? Well, there are a number of reasons, but the most common reason is the child has been sexually abused or exposed to sexual stimuli that's beyond their developmental level, and in order to try to understand it, they play it out. They play it out like they play out other activities in their life. This is how children process information. When working with children, all interventions will be more successful and less likely to cause harm if they match the child's developmental level. It's important to understand what may or may not be developmentally appropriate for each age and stage of development. And child therapist has to have awareness of the child's cognitive, emotional, social, sexual, relational, and other developmental facets. This means using language that's appropriate for a child's developmental age, understanding how a child communicates non-verbally at their developmental level, and responding to them in developmentally appropriate ways. Frankly, treatment that is not developmentally in sync with the child's development has the potential to cause harm. So, back to why children act out. They do act out for a reason. And in order to ascertain what the precipitating factors are in each particular child's situation, it's integral that a thorough assessment take place initially and that reassessment continue during treatment. Although there are a number of reasons why children can act out sexually, the most common reason is, as I've already noted, children can be, have been sexually abused in some way or are exposed to inappropriate sexual stimuli that's beyond their developmental level. Now, is every child who's sexually abused traumatized? No, but the vast majority are. I'll give you an example of a child that I worked with that wasn't traumatized. Many years ago, I had parents bring in a 4-year-old to see me. Grandma lived in a different city, quite far away, and she came at Christmas time with a new grandpa. The grandpa seemed to be quite nice. Child was having a nap. The family decided to go shopping and left the 4-year-old at home with grandpa to babysit. When they came home, it was obvious that the 4-year-old was very, very distressed. And after some coaxing, the 4-year-old explained that grandpa had done weird push-ups on top of her, squashed her, and hurt her pee-pee. This was the kind of language that one would expect from a 4-year-old, and the parents were very appropriate in the response. They immediately told her that they're going to make sure grandpa would never do this again. They called the police. In this particular situation, the police were fabulous. They interviewed the child in front of the parents, and they did the interview in a developmentally appropriate way. And luckily, grandpa kind of admitted what he did, which meant the child didn't have to go to court to testify or anything. And he was obviously removed from the home, and the child was brought in to see me. This child was pretty upset about what grandpa had done. However, she was not traumatized by her abuse. However, in most cases, children are traumatized by their abuse. So it's very important for therapists that work in this area to be extremely familiar with trauma, how to assess whether a child is traumatized or not, because treatment for a child that's been traumatized is different from a child that's really distressed and maybe suffering a number of distressing symptoms, but is not actually traumatized. I think it's critically important that we nip these behaviors in the bud before they become problematic. I have worked with adults who did not receive therapy as children, and where they have continued to act out sexually. No child wants to grow up to become a sex offender. And most of these children, even without treatment, won't. it's prudent for parents and caregivers to educate themselves, to find a therapist that they feel confident with, and to ask many, many questions, and to expect their questions to be answered. Thank you very much, and have a good day.